On the pandemic front, the daily COVID-19 infections across India have gone below the 300,000 mark, striking a faint note of hope in almost a month fraught with surging COVID numbers and deaths. Over 281,000 fresh cases have been recorded in the last 24 hours, and the nation's total caseload now stands at 24.97 million. However, there is no major change in the daily number of new deaths related to coronavirus. The deaths have, in fact, gone up. Over 4,000 deaths have been recorded in a single day, and the overall death toll is now at 274,390. The significant slump in new COVID infection is welcome news for a nation struggling to contain the surge, opening a short window for officials to devise strategies and prepare for a very likely third wave that awaits the nation. India opened up vaccinations for all adults from May 1, doubling the number of those eligible to an estimated 800 million. Still, domestic production will stay largely flat until July, at about 80 million doses a month. This despite India being the world's largest vaccine-producing nation. According to Indian Health Ministry data, only 141.6 million have received at least one vaccine dose, or roughly 10% of its population of 1.35 billion. The country has fully vaccinated just over 40.4 million people, or 2.9% of its population. Urging states to add intensive care units and strengthen medical workforces, the central government has pledged to bolster vaccine supplies. Most of the Indian states have put COVID-19 lockdowns in place to help contain the pandemic. Lockdowns have helped limit cases in parts of the country that had been hit by an initial surge of infections in February and April, like Maharashtra and Delhi. Maharashtra's Mumbai is one success story. Mumbai's civic body BMC put in place a slew of systems to bring down the COVID curve, and now BMC Commissioner Iqbal Singh Chahal has laid down lessons for other states on oxygen crisis management. Chahal has also estimated to administer nearly 200,000 doses per day across Mumbai. But vaccine availability remains the biggest stumbling block.